Hello, good evening, everyone. It's another beautiful Tuesday evening, and you are welcome to Talking Health with Dr. Laz, your favorite health program on television. We are reaching you as usual on your television channel of choice, the Africa Independent Television, AIT. My name is Dr. Laz Eze. You may have noticed that we have a sign language interpreter. We don't want to leave anyone behind. Our viewers who have hearing impairment will have opportunity to follow on the show, and they can also make contribution and ask questions, especially through our social media channels and other communication platforms, and we are going to provide answers to them. On the program today, we have a very important topic, which I know so many of you will be very much interested in, is typhoid fever. Have you ever been diagnosed of typhoid fever before? Have you ever been treated of typhoid? Have you ever been told that you have typhoid and malaria? You know, it's a very common diagnosis in this part of the world. For many people who have a high temperature of 37.5 degrees and above, they're usually told they have typhoid fever. So on the program today, we are going to be learning more about it. We know about the symptoms and signs. We know the appropriate diagnosis to be made. How are we going to get it treated when it's properly diagnosed? What are the possible complications? What are the other things that might mimic typhoid fever, but it's not actually typhoid fever? Health is a teamwork. So on the program today, we'll be talking to an infectious disease expert. We'll also talk to a medical laboratory scientist and also a pharmacist. So the three of them are going to weigh in to provide their perspective for us to know more about typhoid fever. So I'm not going to take much of your time. We are going to go into the discussion proper. But don't forget to follow us on social media platforms, Facebook, Twitter, Instagram, and also Talk Health Niger TV. They are all displayed on your screen. And keep on sending questions, making comments, and getting your perspective as this program continues. And also even after the program, we always find time to provide feedback. Right after this break, I'm going to introduce my guest, and we get in proper into the conversation. Thanks for staying with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. My guest is seated here, Dr. Chukwuemeka Anya. He's an infectious disease consultant and has a lot of experience when it comes to managing different forms of infectious diseases. And along the program, we're also going to be speaking with pharmacist Onimisi Peter. He's a pharmacist, and he would come into the conversation and speak about aspects that are related with abuse of antibiotics. We're also going to be talking with a medical laboratory scientist where we are going to demonstrate the typhoid fever testing. Dr. Anya, you're welcome to the program.
My pleasure.
Yes, there's so much to talk about, and I'll quickly get straight to the point. What are the causes of typhoid fever?
Well, before I get there, thank you for having me. Let me first of all say that for me it's a breath of fresh air, having the opportunity to discuss something health-related that is not COVID-related. It was getting suffocating, you know, talking about the same thing over and over again. Mm-hmm. What causes typhoid fever? Well, typhoid fever is caused by an organism called Salmonella enterica typhimurium, which we can call it for short Salmonella typhi. It's a severe acute illness, potentially dangerous, capable of going the whole length, I mean, taking people out, killing people. Highly infectious. Closely related to it is an illness called paratyphoid disease caused by Salmonella paratyphi. Okay, that one has different strains A, B, and C. Now, some people decided to group them together, called as typhoid fever. Some just group them together and call them enteric fevers. Okay, and the paratyphoid fever is a little less vicious than typhoid fever itself. Even though, these days it's said to be getting more common than the typhoid fever itself. Getting more common, but it's not as vicious. So
whether it's typhoid fever or enteric fever, you know, they are speaking about the same thing.
Yes.
So how would someone know that he or she has typhoid, or suspect that he or she has typhoid fever? What are the symptoms and the signs?
Well, for us in the tropics, for our environment here, it's not as straightforward. It's not very easy. There's a great overlap between symptoms of malaria and typhoid fever. That's the truth. Okay, normal fever that one would have, headache, generalized body pain, joint pains, may have diarrhea, vomiting. Same things you have when somebody has malaria could be found in typhoid fever. Incidentally, well, they may present a little differently. Okay, there may be some things you see that should tell you that this is more likely to be typhoid fever than malaria. For instance, in typhoid fever, you don't have, usually when you have a febrile illness, when you have fevers, you usually will develop blisters quite often. Okay, from
blisters
way back,
is those ones by the mouth?
Yes, those ones on the mouth. People have when they have, that's actually a different infection.
But some people say it's herpes.
Yes, that's what it is. It's a different infection called herpes, but that reactivates itself when people have febrile illnesses or periods of stress. Usually that occurs when you have febrile illnesses from other causes that are not salmonella related, that are not typhoid fever related. When you have those, it's unlikely to be typhoid fever. Now the fever in typhoid fever is slightly different. The pattern of the fever is slightly different from the one in malaria. Now, depending on the strain of malaria you have, you can have fever. Well, usually would have fever that's intermittent. Okay.
So intermittent means that it starts, it stops,
starts again after 1 or 2 days or 3 days, depending on the strain of malaria parasite pattern, or depending on what organism is causing it. But when you have typhoid fever, what you have is the person has fever almost all the time. Okay. The fever temperature rises a bit. Okay. And then stays there for maybe a period of 12, 24 hours, and then rises further, and stays there for another 12, 24 hours, rises further. So you have what we call a step ladder fashion of rise in the temperature. That can help you differentiate, from this normalization of temperature of the temperature that you have in malaria.
Okay, let me stress that part. We have a lot of, almost everybody in Nigeria that has a febrile illness, they will just say it's typhoid and malaria. Yeah. So anybody that is watching this will be able to know that if it's malaria, let's say around 4 p.m. today, the fever starts, you might be shivering and all that. Tomorrow morning you feel better, right?
Exactly.
Then in the evening it will start again, and you might feel a little better the next day. But if it's typhoid, the fever never stops.
Yes, exactly.
So it continues. Maybe it's 38. It stays that way. Tomorrow it might get to 38.3.
Very good.
It gets to 38, but it just continues.
Yes, because it used to rise.
Step ladder. Yes. The other one is intermittent.
Intermittent, yes.
Okay. I think it's really important that everyone watching this understands that. So what is the appropriate test for typhoid fever? To diagnose typhoid fever?
The appropriate test to diagnose typhoid fever should actually be a culture. A culture of a specimen obtained from the body. It could be blood, it could be stool, it could be urine. Unfortunately, what we have in our environment, let me just mention that, is that many people go to use what we call the Vidal test. Well, we call it, because it starts with W, we call it Vidal, but I think the pronunciation is German. It's actually German. So it's called Vidal test. What happens is many people use that test to make a diagnosis, and most of the time we get it wrong for several reasons. There's this reaction that occurs in medicine when you say amnesia. Amnesia means to forget. So when something is anamnestic, it means it doesn't forget. So what happens is there's a reaction that occurs when people develop, when people get infected with typhoid fever, or with salmonella, sorry, they develop antibodies. Antibodies are just soldiers specific to that salmonella that tell us that this man has been infected with salmonella. The soldiers are supposed to fight the salmonella directly. When they develop typhoid fever and they have finished fighting that, the soldiers are supposed to gradually disappear. And only appear again when there is a specific other infection of salmonella. But the anamnestic reaction occurs in such a way that the person develops antibodies, salmonella antibodies, to virtually every febrile illness that occurs after he has been exposed to the salmonella infection. So if he has malaria,
It
you have
comes
very
up
high
again.
titers. If he has pneumonia, you have very high titers.
Okay.
He has a urinary tract infection, he has very high
Yes.
titers.
Okay, we're going to come to that.
Okay.
We are going to go into a laboratory where I'm going to speak to a medical laboratory scientist, and we're going to display some of the culture media and how this culture that Dr. Anya has talked about, how they are going to be demonstrated in the lab. And when we're done with that, we'll come back to the studio and I'll continue the conversation with Dr. Anya. And pharmacist Onimisi will also going to be joining us on Skype, where he's going to be interviewing in this conversation. Thank you. Please stay with us. Yes, I told you we are going to be coming to a laboratory to speak with a medical laboratory scientist. And I'm here with Abigail Anugengen. Pleased to meet you.
Pleased to meet you.
And thanks for making out time out of your very busy schedule. I can see a whole lot before you, doing a whole lot of analysis. We are discussing typhoid fever. And part of the conversation that came up is about the laboratory diagnosis. We've noted that Vidal test is almost useless. So what's the appropriate laboratory diagnosis for typhoid fever, and could you explain it a little better for our viewers to understand it more?
Okay, all right. Thank you very much for having us today. For the diagnostic approach on typhoid infection, it's usually aimed at directly targeting the bacteria, the bacterial product, or the or measuring the host immune system, the response of the host immune system in clinical samples. And like you are already aware of, we have the Vidal test, which is under the serological test, and we have the cultures, and then the PCR, which is like the highest form. Under the culture, you have the blood culture, you have the bone marrow culture, the stool culture, the urine culture. And we have a lot of comparative studies amongst these different samples and the cultures. So, for example, a study that was carried out by Harvard Medical School showed that, very recently actually, just 2019, showed that the bone marrow culture is actually the most sensitive. It's about 63%. And also, WHO also is recommending, actually has published, that the bone marrow culture and the blood culture are the gold standard when it comes to diagnosis of typhoid infection. Then the same study by Harvard Medical School reported stool culture to be 50% and urine culture to be lesser than that for stool culture. So on the scale, I think bone marrow culture, then blood, you have the blood, stool, then urine, lastly. And each of these are different, there are different processes and procedures. So you take the sample, then you culture on the appropriate medium. Then
can you share examples of those media?
Okay, so now, for example, you have the stool. You first of all put it in an enrichment agar, which is the selenite broth. Then from there, when you notice selenite F broth, yes. So if you notice any growth, then you then after the enrichment, you take it over to the SS agar. You then culture on SS agar. And then if you notice, you observe within 12 to 24 hours, you notice a growth. Then you do your gram stain, you view under the microscope, you do your biochemical test. So be sure that this is Salmonella typhi.
Is it proper for a citizen to walk into a lab and say, I want to do blood test, I want to test myself for typhoid fever? You know, is the medical laboratory scientist supposed to just take the sample from that person and do it, or must it be with a referral from a healthcare provider, be it a doctor, a nurse, or a community health officer, as the case may be?
Yeah, I think following the line of things, just like if you go to the hospital, it should be like, you should follow a particular order. Like the doctor requested for this test, then maybe you are not doing the test within the hospital, you are taking it to a private lab. So it should come with a reference, like from a doctor. Because if the individual is just coming in, okay, maybe I have typhoid and I feel like I have typhoid, I'm going to the lab, and then, okay, do typhoid test for me. And then the result comes out. How am I supposed to treat myself? So I think it's better it should come from the doctor.
Okay, so
everyone just sticks to their own area. Like a doctor cannot come and run Vidal test. Likewise, I'm not expected to prescribe drugs to a patient. So my area is to run this test. I stick to that. I run the test. I give you the results, or if I'm sending it directly to the physician, I send it directly to the physician. And that is my part. And even if most times the problem kind of comes from the patient pushing and wanting to just get the quicker way out. You can also try and advise the patient that, no, I'm not in the position to give you this. I'm not in the position to prescribe these drugs, but you go back to your physician. They are in the best position to do this. So I think it will also help.
Thank you very much. I've been speaking with Abigail Anugengen. She's a medical laboratory scientist. And she made that time for her very big. I could see a lot of gene expert machines and a lot of analysis going on around there. And we're going to go back to the studio and continue the conversation with Dr. Chukwuemeka Anya.
Thank you.
Join us. Welcome back to the program. We are continuing with Dr. Anya, who is an infectious disease expert. Before we went to the lab, we were talking about the Vidal test and how some other febrile conditions or fever-causing conditions can actually make it raised. That one is a very long conversation on its own, but there are so many other aspects I want us to go through in this conversation. There's a study actually that is supporting what you're saying, a study that was done at University of Benin Teaching Hospital in 2016, where 271 blood samples were taken and Vidal test was conducted on all of them. 46% were reactive, that's 1 to 160. Then when culture test was conducted, only 22% were confirmed to have typhoid. So you could see the difference. So the Tanzania study, this was done in June 2019. That was Dar es Salaam Referral Hospital in Tanzania. 158 patients participated. 81% of them that had fever tested positive or significant to Vidal test, but only 11% were found to be positive on culture. So what this is saying is majority of those who are told that they have typhoid actually don't have it, in support of that position you took before we went to the lab. But could you quickly, like 1, 2, 3, list those other conditions? You've mentioned malaria, you've mentioned urinary tract infection, other conditions that could be positive.
Any condition that gives you fever, could be misinterpreted by the body as being interpreted by the body as being caused by salmonella. So it just shuts out salmonella antibodies. So whether it's a pneumonia, whether it's a bronchiectasis, any acute infection that causes fever can lead to the production of high levels of the antibodies. Yes.
So is typhoid fever curable? Is it treatable? How is it managed?
Yes, it is treatable. It's once you're able to make a diagnosis, you're sure this is what it is. Yes, antibiotics are available. Before now, well, I wouldn't be discussing antibiotics on air, but yes, it is curable. There are antibiotics available. You feel ill, get to the hospital. We should make it a habit, okay? Especially these days of, there's so many things. We just left COVID for today, because but the truth is, even COVID can present with a lot of the symptoms we mentioned. So if you feel ill, let's try not to do self-medication anymore. Get to a hospital.
One of the reasons people give is when they have fever, they always tell them they have typhoid and malaria when they go to the hospital. So if you tell them go to the hospital, you say, what's the need? When we go to the hospital, they will still do tests and prescribe the same drug. So why shouldn't I just go and buy it over the counter?
Well, I think medical practitioners will need to up our game. That's the truth. We can't that concept of that typhoid malaria, I don't know where it came from, but it shouldn't be sustained. Let's work towards making appropriate diagnosis.
Okay.
Using the appropriate tests, know people that have this thing and get them treated appropriately. Truth is, not every malaria that is treated and fails to respond is typhoid fever. Not everybody that has a fever that is not responding to anti-malarials has typhoid fever. Typhoid fever is not a severe form of malaria.
Okay. Let's go on Skype because pharmacist Peter Onimisi have been waiting for us to contribute to this conversation. Pharmacist Peter, are you there with us?
Yes, I'm here. Good afternoon.
Oh, thank you very much. You may have been listening to our conversation. It's been established that many cases that are treated as typhoid fever are not really typhoid fever because Vidal test that is used is not a very good test. In fact, our specialist says it's almost useless in the diagnosis of typhoid fever. So, but many persons have been taking antibiotics for this. What's the implication of taking antibiotics when there is really no case of typhoid fever?
All right, thank you. And thanks for the opportunity to be part of this program. I quite agree with Dr. Anya that people actually misuse antibiotics or people are misdiagnosed of typhoid fever. The implication of using antibiotics without proper prescription from an appropriate healthcare personnel, it's exposing yourselves to antimicrobial resistance. So, the more we continue to use antibiotics inappropriately, so the more we breed organisms that are resistant to these antibiotics. So, and what that has for us is it gets to a stage where these antibiotics no more work for, what they are indicated for. So, of course, and that will become that's a disaster on its own. So, where you have drug insecurity, so we now have infections that are no more responding to the available antibiotics. And it poses an enormous cost, to the industry. So the earlier we work very hard to stop this indiscriminate use, the better for the society.
So looking at all these different aspects of this, what are your recommendations? Where do we go from here? How do we find solutions to this rampant misdiagnosis of typhoid fever and even indiscriminate use of antibiotics in this regard?
Well, maybe I just paint a picture because it will speak 1,000 words. You see, like I knew somebody, a doctor, that had a febrile illness and was eventually using Vidal test diagnosed to have typhoid fever. He was commenced on a certain medication, which I would like to believe right now is obsolete. And he had an idiosyncratic reaction to the drug, and the thing knocked off his...
Idiosyncratic reaction is like excessive reaction.
Well, not what was expected, okay? Well, not what happens, but can happen, okay? Not the usual, but that knocked off his bone marrow. He couldn't produce any more blood. They transfused him so many times over and over and over. Eventually, he died. He was a doctor. When you say when you tell this kind of stories, okay, we're talking about real life situations, okay? Now, he probably didn't have typhoid fever, but the wrong mechanism was used to make a diagnosis. He probably had malaria that was resistant to what he was taking. So the wrong diagnosis, using a wrong means, led to wrong admission of wrong antibiotics, wrong drugs, and eventually wrong complications developed, and eventually the man died. What else can we say? If it is possible that because the truth is, there are lots of pecuniary considerations in a lot of things that are happening, whether in drug prescriptions, whether in using these mechanisms to make diagnosis. there are a lot of pecuniary considerations.
By pecuniary consideration, you mean
there's
that people are
money to be
making
made,
money
there's
from
business
it.
involved.
You know, sometimes this grammar, we need to we need to use very clear terms. People are doing it for the sake of making money. At the risk of the health of the population.
We are supposed to be honorable people. We should be honorable people. How much extra, would that amount to when it hasn't been done the right way? And it would even be worse if the person prescribing has an idea that what this man has is not typhoid fever, and you're giving him drugs you know he doesn't need just because you have to make a little more money. Let our conscience be the judge.
Yes, so let our conscience be the judge. Thank you very much, Dr. Chukwuemeka Anya, an infectious disease consultant, for your sharing your thoughts on this program. And thanks our viewers for listening. I also want to thank Mazi Ogbonnaya, who has been interpreting with sign language to many of our viewers with hearing impairment. We know from now you begin to participate more on this program, because some of you actually reached out to ask for this, and we are glad that Mazi Ogbonnaya have joined us to provide this interpretation. So if you don't get any message today, just know that not every case of fever is typhoid and malaria. Know that Vidal test is not the appropriate, in fact, it's almost useless in typhoid diagnosis. And note that antibiotics is not a drug that should be used anyhow. We'll call it a day, and same station, same time next week. We'll welcome you back. Once again, my name is Dr. Laz Eze. Follow us on our social media handles and keep the conversation going. Bye for now.